Okay. Hi, guys. Thank you again for joining for the second time since the first time we had technical difficulties. Not surprising because Henry and I are behind it, and computers are not our friend. So, just to go over what we're doing here is this is my final presentation speech for my public communication class. And so we're going to be talking about a sensitive subject, and it's going to be about the myths surrounding organ donation. So again, we'll just go through it one more time, just if you wouldn't mind by show of hands, how many of you ever thought that if you were a registered organ donor, that medical professionals wouldn't try as hard to save your life? I will raise my hand. I was one of them. Absolutely. So this speech is not to persuade any of you to be a donor. It's just to, basically, like I mentioned, just to debunk those myths. And so I have actually been working in the organ donation field for about 8 years, coming up on 8 years. And I've noticed just in the 8 years that I've been doing this that there isn't much publicity surrounding organ donation. Either you learn from it, in school, like a health class, or, just going to DMV, they ask you if you want to check the box, yes or no. And so a lot of people don't, again, because of these myths. So I just thought that I would try to debunk some of them. So first, medical professionals have an ethical and legal obligation to save every life. And basically, before, the determination is made on when, there isn't a chance of any kind of meaningful recovery, or that a patient is actually brain dead, there's a series of tests that have to be involved first. And so one of those things could be making sure that there aren't any sedatives or paralytics in the body. Another thing is just, to run lab tests and make sure that there aren't any contributing factors, such as a sodium, for example. It's one of our electrolytes. It's in our body. The normal sodium levels are 135 to 145. Anything outside of those ranges could actually mask the symptoms of a coma. And so doctors have to check all those boxes. There's actually a checklist that they have to follow to make sure they're hitting all those things. And then they follow that up with diagnostic tests just to make sure that their brain is not functioning. So once all those determinations have been made, that's when the physicians will actually come in and have a conversation with the family, let them know that there's no chance of a meaningful recovery or they are in fact brain dead, and then a representative from your local organ procurement organization, we call it OPO for short, will come in and have those end-of-life conversations with the family and see if it's something that they'd be interested in. If they're a registered donor, that's a little bit different of a conversation. But then the next myth that we're going to talk about is religious components. So there are certain religions that, people will say that, they don't believe in donation. A lot of, if you look at like Judaism, for example, they try to say that, a lot of people will try to say that, they don't believe in donation, when in fact, they actually don't believe in having autopsies, because autopsy is basically a disgrace to the body. But organ donation isn't, because there's a chance there that they can give the gift of life. And so the final myth that I'd like to talk about is, it would affect someone's appearance. For example, they wouldn't be able to have an open casket or a viewing. That's also a myth, because organ donation, the procedure itself is very similar to a surgical procedure, right? So the only thing that you're going to have there is incision lines. The only thing that we ask is that if you are planning on an open casket or a viewing, that you dress the body in long sleeves and pants to cover those incision lines, but the body integrity remains intact. And so just basically in conclusion, as far as organ, eye, and or tissue donation, it's a personal choice, and I feel like you should make this choice based on, being educated and not based on some myth. So it's definitely a conversation to have, and then there's resources out there, plenty of websites, donatelife.net, where you can find more information. So now I'd like to open it up to any questions or comments.
I have a question. How did it turn from the myth about not a religious belief not making you able to donate? How did that come to be?
I think just like I said, many years. Like if you nowadays, because there's so much education, they're actually finding that in all religions, it doesn't say that in any religion. It could be from, the Muslim religion, Judaism, Catholic. There isn't anything that states within their religion that donation should not happen. There's just these certain practices that they follow that could prevent, donation from happening. Like, for example, the Judaism, their practices that they have to bury the body within, 3 days of death. And so there's things that we can do to expedite that process to where both things could still happen.
Okay.
Mm-hmm. So it's just more of an ancient myth that no one could ever really prove. And so now it's coming to light that we can't prove these things.
Got it.
Mm-hmm.
So did you say that they have to actually, they go through the series to make sure that they're actually brain dead?
Mm-hmm.
Right? They have to be brain dead before any of that takes place, right?
Well, actually, donation can happen two ways. So we call another acronym that we use in the donation world is DCD. It's called donation after circulatory death. That was actually, if you look at the history there, that was the first way that donation happened, because brain death and them finding that there's no, the cessation of all brain function has ceased, that didn't come about until later on. I don't know the exact dates, but basically I think the first organ transplantation happened around like the 1950s, and it was donation after circulatory death. So again, a patient has to be low functioning neurologically. They have to be suffering from a catastrophic event where there's no chance of a meaningful recovery. And so at that point, the family makes the decision to turn life support off because they just feel like the patient's suffering at that time. And so once the heart stops, then the transplant surgeons come in. Extubation, meaning taking out the breathing tube, life support, all that gets turned off in the operating room. And then once they've been pronounced dead, that's when the transplant surgeons come in and the procurement starts. So a lot of times you'll hear harvesting organs. We don't really like to use that term anymore because you harvest, right, like fruits and veggies, and that's what you harvest. You don't harvest organs. So it's actually called procurement. Brain death is it's a series of checklists that are followed. So basically there can't be any metabolic derangements. Like I mentioned the sodium earlier. There can't be any CNS depressant drugs in the body. Like if they came in with a heroin overdose, that's a CNS depressant drug. Or if they were placed on a very heavy sedative or paralytic. Sometimes those things like phenobarbital or pentobarbital, those are medications used to sedate someone, and they take a long time to metabolize in the body. So you might have to wait a couple of days before you run these tests to say that someone's brain dead, because that drug needs to be out of the body. Then a temperature, for example, so they have to have a normal temperature. Someone who's cold, you think about a medically induced coma, if you've ever heard that term before. They usually do that. They call it hypothermia protocol, and they do that after a cardiac arrest because it gives the body a chance to kind of rest and recover. And so if they are cold, then that could also mask the symptoms of a coma. So before doctors come in and they test for brain death, they have to run labs. They have to make sure that there's no contributing factors there metabolically. They have to check their temperature. They do a clinical exam, which is testing your 12 cranial nerves to make sure that there's no reaction. And then after that, they'll follow that up with other additional ancillary tests, like they can do an EEG to see if there's any brain activity. There's another one where they inject dye, and then they'll take pictures of the head to see if there's any blood flow in the brain. And so they'll do all those tests before they tell the family that the patient's brain dead. But those are the two ways that donation can happen, is after cardiac death or after brain death.
Okay.
Mm-hmm. Yeah. So any other questions or comments?
Good job.
No. Hopefully this is the last take. You don't have to see me again tonight. And I thank you guys so much for doing this, not only the first time, but the second time also. So I appreciate you all. Thank you so much.
All right. Thank you, everybody.
All right, bye.
Joshie wants to say hi to you.
Hi, Joshie. Say hi to everybody.
Say hi, Auntie. Hi.
Hi, honey.
All right. I'm
All
gonna
right.
pause it.
Bye, guys.
Bye.
Say bye. Bye.